So my specialty is really what we call female urology and voiding dysfunction. So I deal a lot with women who have prolapse, incontinence, and in particular complications from other surgeries in that area. The nice thing about this niche is that for the vast majority of patients, we actually can take patients whose quality of life has really suffered or is suffering and actually fix them and get them back to whether it's 100% or 98%, and there's a lot of satisfaction in that. The first step is to get an accurate diagnosis as to what's going on, but I think also building a relationship with the patient and their family in many cases helps to that end as well. They usually have a general diagnosis, but then the trick is to really figure out which amongst a stable of different diagnoses really applies to them, because the treatments may be very different. It's critical to figure out what the underlying issue is so you can appropriately treat. We may follow them for 6 or 9 months, but I'm a big believer that if everything's going well, you probably don't need to waste your time coming to see me. If there's ever a problem in the future, you come back. On the other hand, there are some things that are perhaps non-surgical or a little more chronic, which patients will see me at regular intervals, but my goal is you only see me if you really need to. The things that I enjoy, to some degree, what we do is a little bit of detective work to try to figure out exactly what's going on. And it's amazing how patients who had been labeled with some sort of lifelong chronic problem, we were able to actually identify a very specific cause, fix it, and they're better. And that's tremendously gratifying. I think the ultimate philosophy, though, the way I practice, and I think many of my peers here practice, is we want to get to know the patient, really find out what is it that they need taken care of, and then figure that out, and hopefully in partnership with them, take care of it.